Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Forum at the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent for Reuters in Washington. And today we have with us Vish Viswanath, professor of health communication at the Harvard School of Public Health and one of the leading experts on the connection between health and the economy. Greetings, Vish, how are you?
I'm fine. Thank you, David.
I've been looking over some of your research, and I think if I had to write a headline to describe it, the headline would say, "Warning, the economy can ruin your health." It seems that the Great Recession has been a disaster for many people who were caught up in it. Having a home foreclosed on you is sometimes the beginning of a string of health problems. Getting laid off can kill people, especially men, and even living in the vicinity of a home that is foreclosed upon can lead to problems including obesity. Can you give our viewers an idea of what it is that you've been looking at and what some of the conclusions are that you've come to?
Sure. So I think the way we talk about recession or a job loss is like an event. But what it is actually a process. And a job loss is one event that triggers a concatenating series of or a chain of events that affect individuals at both physiological, psychological, and social levels. But not just individuals. I think anybody who's involved with the individual, the families, the neighborhoods, and institutions that deal with the individuals are also affected by this process of job loss. I think it has, as I said, the chain includes experiencing stress such as loss of sleep, unhealthy eating, and losing connections to other people. So a whole variety of things can happen as a result of this kind of serious economic disruption. And this is what a number of colleagues at the Harvard School of Public Health and other places have been looking at and trying to understand and disentangle this puzzle between what is commonly talked about as an economic event and the implications for public health.
What kinds of diseases do you find that people develop, or is it not a question of particular diseases but just bad habits?
It's just not a question of one disease or one bad habit. So if you want to say enumerate what happens or what is likely to happen, you can think about it in terms of at least 3 or 4 categories or baskets of things that could happen. So one is, for example, effect or impact on individuals' physiology. So if I'm already not healthy enough, if I had suffer from heart disease or diabetes or blood pressure, these pre-existing conditions are actually compounded or heightened by issues such as job loss or uncertainty. But other things could happen too. People maybe once they experience job loss and lose insurance, they may be trying to save money by not complying with drug regimen. So if they're already taking drugs, they may be trying to save money and not to take those drugs or to extend the prescription so that they don't have to spend the money. Similarly, there are effects on one's psychology. If you think about it, the tremendous amount of stress one experiences could lead to not only distress and disappointment and depression, but also affect their relationship with other people, significant others, members of their families, separations, divorces, in the extreme cases, suicides, and lack of social connections. People are cut off from ties, lack of social support. And it also affects neighborhoods, institutions. So if I'm unable to pay the bill, and get foreclosed, I think I'm unable to keep up the maintenance of my house, the upkeep of my house, that will affect the neighborhood itself. So I think what we are trying to do or say is that we have to frame it beyond one individual's problem in terms of his or her health or disease to this larger ecology of distress that is engendered by this kind of a serious economic recession.
Now, is this ecology of distress a worldwide phenomenon, or does the United States face special challenges in this area?
We are increasingly questioning, say, extension of unemployment benefits. We are running, and a lack of other social solidarity ties, and these kinds of social resources and economic resources are much more fragile in the US than other places. So when you have such fragile social safety net, we are much more likely to experience this this recession much more adversely than in some other countries where the safety nets are stronger.
Now, are these adverse effects that occur, do they survive the economic downturn itself? In other words, as a health event, is the Great Recession over now?
So the recession technically is over, economic recession, but the health effects that were engendered by the recession are being felt only now. And I think we will feel them for years, if not decades to come. And the reason for that is that the impact occurs at a variety of levels, all the way from fetus in a pregnant woman and experiencing the pregnant woman's distress, to all the way to institutional disruption and dislocation affecting neighborhoods and organizations. So we are unlikely to, we have actually not seen the end of it. In fact, we may be just seeing the beginnings of the adverse health impact of this recession.
Given that there's still quite a bit of worry among financial analysts about the health of the financial markets in the aftermath of the recession, why has the question of human health not made it onto the public agenda?
I think that is possibly the most intriguing question that I have been asking myself. And as someone who studies health communication and public discourse about health, this has been a significant puzzle for me. And I only can conjecture, I have some guesses on why that is the case. One, I don't think we are able to capture very succinctly, in a compelling way, the actual public health costs of this kind of a recession. A number of economists have been trying to estimate the cost of the recession in terms of loss of productivity, loss of gross domestic product, and have been able to come up with some kind of an estimate based on some metrics. Unfortunately, I don't think we have spent enough time developing these kinds of measures or metrics in public health. So that's one of the reasons, I think, that we are not able to really capture this in a very compelling way. We have increasingly begun to talk about inequalities in income and economics, from economic terms again. So there is that kind of a movement to talk about inequalities, but again, we have not been able to frame this debate in health terms, particularly public health terms, in a similar fashion.
How long might it take to frame the argument in public health terms? How far is science from being able to actually capture these effects and show what's going on?
I see the problem not just in science, but in terms of translation of that science to influence public thinking, to framing the public agenda to talk about this. And that is the biggest gap, and that's where we need to pay some attention.
The Obama administration describes the Affordable Care Act as a form of economic security. Is it possible that at some point Obamacare will be able to help alleviate this problem during downturns, given that it provides health insurance assistance so that people can actually purchase coverage?
I think in some cases, in certain states, the Affordable Care Act will be able to buffer or act as a buffer to minimize the adverse impact on certain population groups. But as you very well know, it has to be implemented, and the implementation is not necessarily uniform across the country, with varying degrees of opposition in different places, different states. Some states have expanded Medicaid, other states have not expanded Medicaid. So it waits to be seen the extent to which all people will benefit equally from this kind of a serious economic downturn.
Well, I think we're just about out of time for this edition of Health Reform Watch. Thanks very much, Vish, for an enlightening discussion about the connection between health and the economy. Thanks also to our viewers for joining us here at Health Reform Watch. I'm David Morgan. See you next time.